Welcome to the next video on ECG. In this video, I want to talk about P waves and its abnormalities. So this is how a P wave look like, and this is a QRS complex and this is a T wave. Today our focus is going to be this part. Now the ECGs and diagrams that are used in my video were borrowed with permission from following two websites, ecg.utah.edu and ecglibrary.com. These two are very good websites if you want to practice additional ECGs or learn about them in detail. Today is a very special day. Today is Guru Purnima. Guru means teacher, and what we do today in India is we worship our teachers. I would like to begin by telling a small shlok. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Gurur Sakshat Parabrahma, Tasmai Sri Guruve Namah. This video is dedicated to my teachers who treat me as their friend. Number one is Dr. Ambekar sir. Ambekar sir is the most intelligent yet most down to earth and humble person I have ever met. Then Sushant Shinde sir. Dr. Sushant Shinde sir is the reason why I started liking medicine and I started liking teaching so much. Dr. Nagnath Redewat sir. Dr. Nagnath Redewat sir is my big brother and he has helped me tremendously throughout my MBBS and during the difficult times. Dr. Ameya Pathak sir. Dr. Ameya Pathak sir has made me fall in love with clinical medicine. I owe these people a lot, so this lecture is dedicated to them. This video is also dedicated to my best friends who perhaps are my best teachers. Pranav, Suyash, Aditya, Mohit, Charandeep sir, Mayur sir, Suraj sir and Pratik Joshi sir. I need not say much about them as they know how much I love them. In this lecture, we will be talking about P waves and its abnormalities. Let's begin by talking about the P waves. P waves basically denote atrial depolarization. That is, as the current of depolarization originates in SA node, it tends to spread throughout the atria. And this spread of depolarization current on ECG is recorded as a positive deflection that is called as a P wave. The normal duration of P wave is less than 0.12 seconds, that is less than 3 small boxes. Then normal amplitude or normal height of P waves is less than 2.5 millimeters in the limb leads, with positive deflection being less than 1.5 millimeter and negative deflection being less than 1 millimeter. What this means is that if you have a P wave that is like this deflection has to be less than 1.5 millimeter and this deflection has to be less than 1 millimeter to be called as a normal P wave, and this entire deflection has to be less than 2.5 millimeters. A P wave that deviates from these two morphological criteria is considered as abnormal P wave. Then before diving into abnormalities of P wave, let's have a look at how a normal P wave will look like in different leads. So P wave has to be upright in lead 1, 2, AVF and V4 to V6. That is, P wave in these leads should be like this. Then P wave can be upright or biphasic in lead 3, AVL, V1 and V2. In these leads, it can either be like this, that is biphasic, or it can be upright. Then P wave can normally be negative in lead V1. That is, in lead V1, you can sometimes normally see a P wave that is like this. Coming to the abnormalities of P waves, number one and perhaps the most important one being absent P waves. It is seen in atrial fibrillation, AV nodal reentrant tachycardia and sinus arrest. Atrial fibrillation and AVNRT are arrhythmias that I talk about in detail in the lecture on arrhythmias. For now, for sinus arrest, just remember that sinus arrest is SA node dysfunction. Then there is a very characteristic pattern called as sawtooth pattern of P waves that is seen in atrial flutter. You can remember this as something looking like this. A pattern which looks like blade of saw. Then you can see multiple morphologies of P wave in a single ECG. Like if you are looking at a lead 2 of an ECG and you see first P wave looks like this, then second P wave probably looks like this, then third P wave looks like this, and fourth P wave looks something like this. This tells us that the pacemaker is not at one place. The pacemaker for this is different than the one for this, which is different from the one for this, which is different from the one for this. That is why the direction of spread of current is different, which leads to the changed or different deflection in each and every P wave. So this is characteristic of a condition called as a multifocal atrial tachycardia, in which you see 3 or more morphologies of P wave in a single ECG. Then there are two very interesting abnormalities, that are P mitral and P pulmonale. P mitral can be seen in left atrial enlargement and P pulmonale can be seen in right atrial enlargement. You can remember this by the fact that mitral wall is in the left side of heart and pulmonary wall is in the right side of the heart. Then what you see in P mitral is a notched P wave, a broad and notched P wave in lead 2, and a biphasic P wave with large negative deflection in lead V1. This is how P mitral is seen, this in V1 and this in lead 2. Then P pulmonale is seen in right atrial enlargement. What I want you guys to focus on when you are looking for P pulmonale is the inferior leads. You see a tall peaked P wave in the inferior leads in P pulmonale. Now can you guys remind me of what all are the inferior leads? Yes, you are correct. These are 2, 3 and AVF. Then what you can see is one more abnormality is inverted P waves in lead 1 and 2. Remember that P wave has to be normal, or that to be called normal, P wave has to be upright in lead 1 and 2. It is seen inverted in two conditions. Number 1, dextrocardia, that is if your heart is on the right. Then perhaps the more common and important one is lead misplacement. If you have placed lead 1 at the place of lead 2 and lead 2 at the place of lead 1, that will result in inverted P waves in lead 1 and 2. So now, having looked at the theory, let's look at few ECGs that will demonstrate few of these abnormalities. Henceforth, whenever I say 1 second, it means that I am going to take a 1 second pause for you guys to interpret the ECG. So 1 second. Alright, while looking with perspective of P wave, I want you guys to focus on lead 1 and 2, and you can see that lead 1 has a positive deflection and lead 2 has a positive deflection in place of P wave, and each P wave is followed by a QRS complex, which meets the definition of the ECG being in sinus rhythm. And also the heart rate, if you consider this as a first QRS complex, this would be 300, this would be 150, this would be 100, this would be 75, this would be 60, and this would be 50. So heart rate is somewhere between 50 to 60, which tells us that the patient is having bradycardia. So this ECG is showing sinus bradycardia with perhaps normal P waves. I just included this so that I wanted you guys to focus on how normal P waves look like. 1 second. Alright, in this ECG, I want you guys to focus on lead 1 and 2 again. So you can see lead 1 has upright P wave and lead 2 has upright P wave, and each P wave is followed by a QRS complex, which tells us that the ECG is in sinus rhythm. Then I want you guys to focus on lead V1, this lead down here. So lead V1, as you guys might have noticed, you can see a large negative deflection in place of P waves right here. So can you guys remind me of a condition in which we see a large negative deflection in P wave in lead V1? Yes, you guys are correct. It's P mitral. So this ECG is showing LA enlargement. 1 second. Alright, in this ECG, I want you guys to have a look at all the leads, but I want you guys to predominantly focus on the inferior leads, lead 2, 3 and AVF. You can see that there are tall peaked P waves in lead 2, lead AVF and lead 3. So can you guys remind me of a condition in which we see tall peaked P waves in inferior leads? Yes, that's correct. It's P pulmonale, or which is seen in RA enlargement, right atrial enlargement. 1 second. Alright, so what I'll do is I'll approach this ECG from very basics. So first of all, I would like to look at the rate. If you consider this as being the first QRS complex, this would be 300 and this would be 150. So heart rate is close to 150, which tells us that it's a tachycardia. Now we are not able to see any P waves. These waves that you are seeing are T waves. Now remember, it is very uncommon to see absent T waves or flat T waves. So if you are seeing only one of them, like only one of P or T, it is more likely to be a T wave, because absent P waves is far more common than absent T waves. Then can you guys remind me of 3 conditions in which we see absent P waves? Yes, that's correct. It's atrial fibrillation, AVNRT, then sinus arrest. Now, how to differentiate between these 3 conditions? I again talk about I talk about it in detail in my video on arrhythmia, but just to give you guys a brief idea, in atrial fibrillation we see irregular heart rate, irregular heart rhythm. In AVNRT we see a regular heart rhythm and perhaps tachycardia. And in sinus arrest we see bradycardia. So if we fill the gaps, we can safely say that this is tachycardia and it is regular. So the diagnosis here is AVNRT. This is a very characteristic ECG. I want you guys to focus on these 2 leads. You guys can see that this looks more like sawtooth, a pattern somewhat like this, which tells us that this is a sawtooth pattern. Can you guys remind me of a condition in which sawtooth pattern of P waves is seen? Yes, that's correct. It's atrial flutter. So this is perhaps one of the easiest ECGs to identify. It is atrial flutter. Thank you so much guys for watching my video. If you like my video, please subscribe to my channel. I will be posting series of videos on ECGs and other topics in upcoming weeks. If you have any questions, concerns or doubt, please feel free to reach me at love.intmed@gmail.com. Here comes the mandatory slide. I like to conclude all my presentations by the next slide by remembering the motivation for me to come in the field of medicine. My uncle, late Dr. Sanjay Tiwari. I used to call him Dr. Chacha. I just want to give him one message, that whatever I am is because of him and he is being missed every single day. Thank you so much guys, and I wish you good luck.